All right, do you ever get ringing in your ears? I feel like we've all experienced that, have we not?
All the time.
It's a condition that over 25 million adults suffer from.
Yes, it's called tinnitus or tinnitus. We'll get into that. Joining us live to talk about it here in studio, and of course how weather plays a role in people suffering from this condition. We got Dr. Melissa Wikoff. I know, I didn't either.
Yeah.
The founder and director of audiology at Peachtree Hearing and a board member of the American Tinnitus Association. Good morning. How are you?
Good morning. I'm great. Thank you so much for having me this morning.
So, okay, first off, how to pronounce it. I've always said tinnitus, but it might be tinnitus.
Yes, there's no wrong way to say it. In the medical community, we pronounce it tinnitus because the pronunciation itis assumes that that's the disease. Tinnitus is usually the symptom of something else.
All right, so what causes this?
And what is
because
it?
Because it feels like it just comes on out of nowhere.
Absolutely. So it is a sound, any sound that you hear that no one else hears. So a buzzing, a ringing, a clicking, a humming, a pulsing, talking. Something that you hear that no one else is hearing. It's usually coming from inside your body. There are all kinds of causes. Usually it's a hearing loss. That's the most major.
After a loud concert, we get the ringing in our ear.
Loud concert, noise exposure, but it could be something else. There could be inflammation, a cold, a flu, sinus, all kinds of other things.
So once you have it, it's hard for it to go away, but how does weather impact whether the hearing is louder or softer, that noise?
Absolutely. So there are several things at play here. So temperature and atmospheric pressure. So it's affected by blood flow. So when the temperature drops and we're cold, our body tries to conserve heat, and so blood gets pumped to our heart and our lungs to conserve that heat, and we lose blood flow to the extremities. And so the number one extremity that's going to go is right up here, your ears. You may notice your ears feel colder faster, and so we're losing blood from our ears to go to our heart, and we notice the tinnitus more intensely. We notice ringing in our ears more intensely.
Hold on. So when the blood comes away, we hear it louder. I thought it would be the opposite. Okay.
I know, yep. So when there is inflammation, it's an inflammatory response. So when there's extra pollen, so in the air, so spring is coming, there's more pollen, we're swollen, we're sneezing, you can notice it more there. As things change, like my grandmother used to tell me her knees would tell her that it was going to rain.
Right. Yeah.
It's the same in your ears. So you won't, I have patients tell me that they know that it's going to be a rainy day or that a storm is coming because they can hear it ringing.
Is there any way to cure it or treat it?
Yes. So it is very, very treatable. And I think that the number one thing that people think is you just have to learn to live with it. And that's the worst thing you could tell somebody, because then you start to ruminate on, I have to hear this forever. No one else is going to hear this. It won't go away. It will so go away. But the solution is very, very unique and custom to each individual patient. So what you and I would do together for your tinnitus is different than the next person.
Can you give us examples of what someone would do? Yeah.
So for some people, it's treating it with sound therapy and using hearing aids. There's also a treatment called linear, which is using bimodal neuromodulation, but we stimulate two pathways at the same time on the tongue and on the ears over a series of several weeks before people feel better, and we're finding a lot of people having success in getting relief.
So what would you say is your best medical advice with someone to either avoid this from happening or is living with it?
Unfortunately, it's very hard to prevent, other than when you know you're going to be somewhere noisy, you're mowing the lawn, you're going to a concert, wear hearing protection. You really want to protect yourself as much as you can. But once it occurs, I think you want to go and get help as soon as possible. You want to get your hearing tested, go see an audiologist, seek treatment sooner rather than later, because we have this very small window when you first hear it where we can completely reverse it and make it go away.
Dr. Melissa Wikoff, thank you so much for the information, for weather awareness, and of course
for the new word I hadn't heard.
The new pronunciation. Jim, over to you.
Yeah, guys, great stuff there, especially for a sufferer of this.